Hello friends, let's today talk about when is hip replacement surgery required in case of AVN. AVN stands for avascular necrosis. So basically it means the death of the bone due to lack of blood supply. And most commonly it affects the head of the femur, that is the ball of the hip joint. Now reasons for AVN are many, like if somebody has used steroid for long terms or excessive alcohol intake, or sometimes it can be because of some old hip injury or fracture. Sometimes in cases like sickle cell disease also it can happen, and sometimes there is no cause. But if somebody is suffering from AVN, then hip replacement might be required. Normally there are 4 stages of AVN based on the X-ray and MRI. Stage 1 is when only MRI change is there and the bone is still healthy and the outline of the bone is maintained. Stage 2 is when the bone damage is visible on the X-ray. 3 is when the bone starts to collapse, that is when the pain starts increasing actually. And stage 4 is when there is a complete damage and the arthritis has also happened. So whenever we are in the early stages, say stage 1 or stage 2, normally we try to preserve the joint. We give medications to improve the blood flow. We ask the patient to reduce weight. We ask the patient to do physiotherapy. Sometimes we go for surgeries like co-decompression surgery with PRP and BMAC to improve the survivability of the hip joint. But sometimes, in spite of everything, the disease progresses and it reaches stage 3 or stage 4. This is when the hip replacement surgery is required. So normally if it is a stage 3 or stage 4 AVN, that means the femur head or the ball of the hip joint has started collapsing. The patient starts getting severe pain, especially while walking, sitting, and sometimes even at the night. There is a loss of joint movement and stiffness also. So in such situations, we cannot go with conservative treatment. We have to go for hip replacement surgery. Normally, if the patient is young, we prefer to go with uncemented hip replacement surgery. In hip replacement surgery, we change the ball and socket of the hip joint with artificial components. And this new joint moves without pain. The patient becomes painless. He is able to walk, stand, and do all his activities. Normally, for hip replacement surgery, patient needs to be in the hospital for 3 days. And this is done through minimally invasive technique these days. Post-operative recovery is also very fast these days. Patient can start walking within 24 hours. Then we start the patient on exercises. So, if you are suffering from stage 3 or stage 4 AVN, then hip replacement might be required. So, consult your doctor and whatever he advises you, follow it religiously and you can get rid of this pain because of avascular necrosis of hip. Thank you.